Hello, my name is Sam Borgel, and I am the Enterprise Sales Specialist for Remote Patient Monitoring at Vive. In this presentation, I'm going to explain what remote patient monitoring is and why Vive RPM is the best solution in the industry. Let's get started with understanding how to set up, collect data to implement care, and earn reimbursements with an RPM program. There's a lot of setup work, but we have set out to make this an easy process for everyone involved. First, it is important to select an RPM vendor that addresses the issues your clinic is trying to solve. Next, patients are going to be identified and enrolled into the RPM program, and this involves collecting demographic information, diagnosis codes, as well as appropriate insurance codes to make sure you will be reimbursed with the CPT codes. Following the identification and enrollment process, the patient will need to be educated about the program and the operation of the device or devices. The patient will then have to consent to be put onto the program, and depending on the condition of the patient, the relevant devices will need to be provided to the patient. Here at Vive, we are able to ship directly to the patient if desired. Upon arrival of the devices, patients will have questions, and Vive has a direct support line as well as other resources to answer any questions that may come up. Patients then use the devices, and adherence is crucial, so we have designed our devices to be user-friendly and easy to operate. The data collected will then be uploaded directly into the online portal or EMR, and in the portal, members of the care team are able to review patient data, and appropriate care can be implemented after reviewing the data. Then, on a monthly basis, claims will be submitted for the RPM codes, which I will walk through in the next slide. Lastly, you'll be reimbursed for your claims. That essentially covers how an RPM program works. Now I'm going to break down the CPT codes for RPM services. There are 5 CPT codes that providers use to bill for RPM, and these reimbursement amounts may vary slightly depending on the location of the practice. 99453 is a one-time billable code per device that covers the initial setup and education of the device and services to the patient. 99454 is a monthly billable code that includes daily use of the device or devices, and it will only trigger once the patient takes a total of 16 readings within a calendar month. 99457 is a monthly billable time-based code for 20 minutes of clinical staff time per calendar month of non-face-to-face interactions around the RPM service. These interactions may include daily monitoring, phone calls, referrals, prescription refills, or anything the care team is doing while the patient is out of the office. 99458 is an add-on code to 99457 and can only be billed concurrently. This code takes into account additional 20-minute intervals over the initial 20 minutes, so think 40, 60, 80 plus minutes. 99091 covers the standalone collection and interpretation of remote data. It includes 30 minutes of RPM clinical time between a patient and a physician or qualified health professional per month, and also requires at least one instance of communication, which can be a call, video visit, or even an email exchange. Because of Vive's affordability, many practices will see a return on investment in as soon as 2 months. When creating Vive RPM, we wanted to help healthcare providers effectively address prevalent issues in the industry. With our affordability, practices can reduce the cost of care for payers and providers. RPM has demonstrated significant impact in reducing unnecessary hospital admissions and readmissions by enabling movement of appropriate levels of acute care and chronic care monitoring into the home, reducing the high costs of inpatient services. Our direct support line and assistance with onboarding helps build the clinician-patient relationship and RPM provides more opportunities for communication, thereby strengthening the patient-provider relationship and improving patient satisfaction and loyalty. To prove the efficacy of Vive RPM and to help integrate RPM into the workflow, we're offering a 30-day proof of concept with devices and software free of charge. Effective and efficient patient onboarding and device setup is crucial to the success of an RPM program. If needed, our team at Vive is able to reach out to your patients and directly onboard them and enroll them into your version of the portal. We also have the ability to ship devices directly to your patients and assist in the setup of the device. We currently offer Bluetooth-enabled devices that connect to our patient-facing application, as well as cellular devices that do not need to connect to an app. All this is to ensure your RPM program gets off to a good start with every practice. An RPM program relies heavily on proper patient adherence to the use of the devices, as well as effective management of the patients that are enrolled. Our devices and application were designed with the patient in mind to ensure the patients are able to quickly and easily take readings, and notifications can also be sent directly to the patient to remind them to use their device and take readings. In our portal, there are adjustable patient-specific alert zones, as well as high-risk patient identifiers, making it easy for providers to spot patients that need immediate attention. A timer is also on each patient's profile to ensure that CPT code 99457 is being tracked. Every measurement that is taken will be uploaded to Vive's secure portal, where the provider can review it without any patient intervention. This portal is very user-friendly and accessible by any member of the care team. And in order to ensure every patient is provided the care they need, the portal has an out-of-range reading or high-risk patient identifier, making it quick and easy to identify patients that need to be addressed. The ability to sort patients by time spent reviewing data ensures that the practice is able to appropriately bill for the CPT code, generating revenue from reimbursements. For providers, Vive RPM provides simple patient enrollment and setup and is incredibly affordable at $7 per member per month for the operation of our software. For patient, Vive RPM provides no-cost devices, direct shipment, and automatic data transfer. CPT code 99454 is designed to cover the cost of RPM devices and the services that they provide, and we kept that in mind with our pricing at Vive. The CPT code alone will cover our costs, allowing practices to generate substantial revenue from the other CPT codes. One of the most important factors in a partnership is support, and very few vendors actually offer the support they say they provide. Vive RPM has a dedicated support team, and patients and providers have the ability to connect directly with RPM sales representatives. Our support is free, based in the US, and is available via phone, chat, and email. We also provide online resources such as videos, blogs, and instructions that can walk you through any question that may come up. On a monthly basis, we also send out monthly content on product feature releases to enhance provider and patient functionality. If you're interested in starting an RPM program or have any questions regarding RPM, you can email us directly at viverpm@vivehealth.com or call us at 239-228-8939. Thank you for your interest in Vive RPM. We look forward to hearing from you. Have a great day.